Hi, my name is George and I'm a pelvic health physiotherapist at Western Sussex Hospitals Trust, and I'll be joined today by my colleagues Nadine and Jasmine. Congratulations on the birth of your baby. You're watching this video today because you've either experienced a tear or had an episiotomy to your perineum during labour. This video will contain some important information for your recovery and how to care for your tear. So we will cover an explanation of what the perineum is, how long it will take your stitches to heal, how to keep the perineum clean and to avoid infection, and what to do if you suspect that you might have an infection, how to comfortably open your bowels in the early days, and what to do if you're constipated. We'll talk about pain relief and comfortable positions for feeding your baby. And we will also talk about when it's safe to return to sexual intercourse. Your perineum is the area of skin and muscle in between your vagina and your back passage. It's very common for this area to tear during childbirth. These tears occur spontaneously as baby stretches the skin. An episiotomy is a cut made here by your doctor or midwife to enable baby to be born more comfortably. Up to 9 out of 10 first-time mothers experience some degree of tear on the episiotomy, and this figure is slightly lower in women who have already had vaginal delivery. With regard to healing times, your stitches will feel sore in the early days, particularly when you're walking and when you're sitting. But they will feel more comfortable as each day goes by, and it's rare to feel any discomfort from minor tears within about 2 to 3 weeks. Your stitches may irritate, and you might be able to feel them while they're healing. Your stitches are designed to dissolve, and so you won't need to have them removed. If you have any concerns, contact your midwife or your GP or your health visitor.
Good hygiene is important to prevent an infection. Change your sanitary pad regularly and ensure that you wash the area daily using only water. We recommend showers rather than baths to avoid soaking stitches in dirty water. It is important to wash your hands both before and after going to the toilet to help avoid infection. Signs of an infection are stitches that become more painful rather than less painful, stitches that start to smell or become oozy or pussy, and stitches that don't heal. You may experience an increase in discharge or bleeding, or feel unwell or develop a temperature. If you have any concerns, please contact your midwife, GP or health visitor. Aim to avoid constipation, as this may put pressure on your stitches. If you've been given a laxative to take at home, please take as prescribed. Drink 2 to 2.5 litres of fluid every day. Eat a well-balanced diet with plenty of fibre. It can be easier to open your bowels if you place your feet on a footstool and lean slightly forward. Take your time, do not rush. You may find it comfortable to support your stitches using a clean sanitary pad or some toilet tissue to support your stitches when you have your bowels open. It is common to experience a stinging sensation when passing water. You can help avoid this by pouring some water from a jug or a bottle at body temperature over the area whilst on the toilet. It is also important to be well hydrated, as the more concentrated the urine is, the more likely you are to feel soreness. If you have been prescribed pain medication, please ensure you take it as directed. Another way to help alleviate any swelling or discomfort is to use an ice pack, such as a pack of frozen peas. Do not place ice directly on the skin, as this can cause an ice burn, but instead wrap them in a couple of clean baby muslins or a clean tea towel.
If you find sitting uncomfortable, you can reduce the discomfort by offloading your perineum, and you can use this simple towel trick. So for the towel trick, take 2 medium-sized towels, roll them into sausages, place them on the edge of the chair. And then when you sit down on the chair, the towels are underneath your thighs, and therefore it offloads your perineum. If you're finding that sitting is uncomfortable, you can try feeding your baby lying on your side. It is not uncommon to experience bladder leakage in the first few weeks after giving birth. however, this persists for more than 3 weeks, or if you're experiencing difficulty controlling your bowels or controlling wind, then you may need some physiotherapy. If you live locally, you can refer yourself to the Western Sussex physiotherapy team. If you don't live locally, then you can ask your GP or your midwife to refer you. We recommend that all women do pelvic floor exercises. If done correctly, they can prevent or reduce incontinence or vaginal prolapse symptoms. Even if you have had stitches, it is still safe and beneficial to do your pelvic floor exercises. They may feel uncomfortable at first, but go slowly and build up gently. For more information about pelvic floor exercises, please refer to our separate video that we have produced. Returning to intercourse is a personal decision, but we do recommend that you wait until you've had your 6-week check with your GP or hospital appointment. It's important that your stitches have fully healed, and you should only return to sex when you feel ready.